Hello, we're Parkland Blue Team, and this is our presentation on telehealth for all. This is our team, and this is the background. With the COVID-19 impact, we saw a rise in telehealth, which we saw overcame some barriers with accessibility. We are working with the Parkland program, which is a large public health system, who created these video visit pods. At the Gaston Center, which is our area of focus, we found that it is a sizable refugee and immigrant population and serves as a launching pad for nonprofits. Our goals were to investigate the current and potential barriers to the community with the use of the video visit booths, and to develop a strategy to increase visitation with these booths. Our strategy was a mixed methods assessment, and we also did a field assessment at Gaston Christian Center. We also collected data using interviews, literature research, and we assessed the Gaston Christian's strengths and weaknesses. Here are the challenges we saw: awareness and community involvement, back-end support and staffing, accessibility, and finally, technical literacy. With community involvement, we saw that there was low community awareness. People were very unsure of what these booths were, and there wasn't much marketing to advertise them. We also saw that there was a lack of trust without a face behind the pod. There's also not much on-site technical help, and the staff working at the IVCC wasn't trained on how to work the booths in order to help the customers with using the booth as well. And the support lines were more for technical errors and not help with navigation. We also saw some challenges with accessibility, where physical barriers for the disabled were very limited. People with mobility aids were not able to use these booths. There was language barriers for those who did not speak English, and there was some confusion over the social security number requirements, which might have blocked some community members from registering. And those who are not as technically literate had a lot of challenges when signing up for the Parkland MyChart account.
So now I will take us through the site preparation. So we are really wanting this telehealth pod to be successful in being implemented in Gaston. And one way we can do this is through increased signage on site. So we do this through, advertising, saying this is a telehealth pod. It's going to have a clear pod design. Everyone will know it's a telehealth pod. Can advertise this through physical and video marketing, which also includes flyers on the physical part, and social media on the video part, and community outreach. Really having the community know what this pod is, what its intent is, and spreading the word. So, one thing that is very essential is the staff training. So, the Gaston staff and the Parkland volunteers who will help implement the system, they'll be told what the pod's purpose is and also what questions may they answer for the people who we want to use the Gaston pod in the Gaston community, and also they can help spread awareness. Then here's a launch plan. Whenever the pod is implemented, we really want to start it off with a really fun event that gets kicked off that lasts for a whole week. This will include tutorials and live demos showing people how to use the pod. Then we'll have account creation assistance. We'll show people how to create an account, help them with it. And at the very end, a big community reflection that we will use to hopefully improve the pod for the future. And now we have a user interface. As Emma talked about earlier, some people they're not experienced with technology, so we really want to simplify the process, make the login register experience as simple as possible. And now we will go ahead and take you through the design that we thought of. So first, we have two big clear buttons, one that says, I have not used a telehealth pod, click me, or one that says, I have used a telehealth pod, click me, and I can log in immediately. And then here's another screen of what we would imagine the login screen to look like. Very simple, very easy to access. And then here are some advantages of our consultations. So it's community driven. It uses existing Gaston community members. It's at a very low cost, and it has dual applicability, so it can be used anywhere that has a telehealth pod, not just Gaston, but also the IVCC, which is the area where we collected all the data to help improve the pod system and help implement in Gaston successfully. It can be implemented anywhere that has a telehealth pod. Then here is our budget. This is kind of an overshoot, but ultimately we aim to have it as inexpensive as possible, easy to implement, and overall it's a very, very easy process. And then here's the conclusion. So ultimately, our consultations will help underserved populations. It will strengthen community involvement, bring healthcare everywhere in the Dallas area, and it'll promote Parkland's mission to promote health everywhere in Dallas. It will use a convenient healthcare model, reduce transportation challenges, along wait times. It will market community champions in Gaston, and of course, the solutions are implemented at a low cost. Thank
Thank
you.
you.